Hello everybody, I'm Sharron Gordon, I'm Clinical Director of Couture Aesthetics and this is our Sunday video. So I wanted to talk to you today about Dermapen. I'm actually modelling it round my neck. This is Dermapen. It's a particular brand of machine which does something called microneedling. So what I want to tell you about is why microneedling is great for your skin, how it fits in with chemical peels and with other treatments, and to really give you a bit of an understanding about what it's like to have this treatment. So for those of you who follow our posts on Instagram, you'll have seen a little demo of it on Thursday as we allowed one of our lovely clients to test it on their hands, which is normal. We don't start off using it directly onto your face. We would let you feel the sensation and understand what the experience is going to be like by doing it on the back of your hand before we get going. But we also, as part of the treatment, don't believe that your face should be glowing and beautiful and the backs of your hands should be missed out. So we will automatically do your face, your neck, your chest area and the backs of your hands at the same time. So here's my microneedling machine. It's a really clever device. I've fitted it with a needle already so you can see, although it's got a cap on it at the moment. But underneath this cap, she said, you'll be able to see perhaps tiny, if I turn it up that way, maybe, no, 15 little tiny needles, and they work on with a machine to go up and down like that within the canister, and then producing about 1,300 little tiny channels in your skin every second. So if you can imagine that moving over the skin very quickly, really it only feels like sandpaper. We can use an anaesthetic cream on it, but generally we don't need to. And what that does is it allows us to put all sorts of products into your skin and for them to soak really down into the dermis. So things we use are hyaluronic acid, we use vitamin A, we use other products to help suppress pigmentation and to create a less kind of blemished look, which is really what I'm particularly interested in. If you've been following my discussion on chemical peels, is I'm on my own skin journey to try and knock down some of this pigmentation and freckling that I've got en masse because of sun damage in my earlier years. So it's 2 weeks since I had my chemical peel, so it's absolutely fine to be microneedling now. I use retinol on my skin as part of my night care routine. I don't need to stop my retinol before microneedling, but sometimes it's good to do that. And I certainly won't restart it for another 4 or 5 days after this treatment. So what's the difference between microneedling and chemical peeling? Well, if you can imagine that with chemical peeling, what you're doing is taking off the surface layer of the skin. With microneedling, what you're doing is putting the little channels down into the skin, which are stimulating, well, depending on the level that you put the needles in, they're either removing pigmentation or stimulating the cells that produce collagen, fibroblasts. So microneedling is stimulating skin to grow new skin, and peeling is taking away the surface layers as well as stimulating the skin to some degree. So put them together in a partnership and you get a much more accelerated response and a much better outcome really than each product alone, although on their own both do great things. So microneedling, as we use it, and I'm going to give it a little demo in a minute, you either are working in the top layer of the skin to target the pigment cells, or slightly deeper down to target the fibroblasts and make more collagen, or a teeny weeny bit deeper than that to remove red thread veins. So it's a really great way of improving the texture and the quality of your skin. And we really do love it. So the benefit is, of course, less pigmentation, less scarring, removal of thread veins, and a much brighter and more radiant complexion. So I'm going to just take a pause, and I'm going to just put this pen together and put some gloves on and prep my skin, and then I'm going to give you a little demonstration of the machine and explain to you how it feels. So here I am back again, and here's our machine all prepped. I've cleansed my face, I've cleaned it with some chlorhexidine wash, and I just thought I'm going to start and do this cheek for you and allow you to see a comparison of how red you are afterwards, because there's a lot of queries about what the downtime is with this and what the experience is going to be like afterwards. So you will be a little bit pink. It'll last a couple of hours, but it'll go down very quickly. And there's a mask that we will put on you afterwards, which really calms it down quite a lot. So let's get going. It's a bit like somebody joining you in the mirror, because I'm going to have to do this by looking in the camera. So this is the machine, all set to go. And I'm going to just start on my cheek. So you can see it buzzing backwards and forwards, and really it feels no more. It goes so fast, these needles, that really I don't feel very much. It's a little bit scratchy. You might see the skin starting to go a little bit red. And we're aiming to go in 4 directions to make a cross and then diagonally. So you can do this at home with rollers that you buy online, derma roller style things. So turn it off and let my skin recover a little bit. You can just see how that's pinking up. But they're nowhere near as efficient as this, and this machine allows you, of course, to go down into the gaps of the nose and round underneath the eyes. And by doing that and stimulating the cells, it's reducing fine lines and wrinkles and getting to all the difficult areas. So there is a reason to come and have professional microneedling compared with doing these things at home. But any microneedling is good in terms of stimulating the skin if you're cautious about what you're doing. So I'm going to sign off, and I'm going to finish half of my face, and then I'm going to give you a little look at how that compares before showing you the end result. So here's half my face done. This side, you can see it's all pink and a little bit raised, and compared with this side, which is still its usual kind of slightly freckled self. This is a treatment for pigmentation, so we're not looking for any blood to be brought to the surface. So I think there's a tiny little vein here that was on my nose that has popped and bled just a tiny bit, but other than that, I feel like I've got just a kind of a slight sensation of having quite a mild sunburn on this side, but that's all. And by the time I've put the mask on for 20 minutes, that will have settled down completely. I will then put a layer of vitamin complex on, vitamin A, to try and help my skin rebuild itself, because it's now sending many signals, all of these cells telling each other they've been damaged and they really need to start building themselves back up again. And that'll be me then set and ready for my day. I have to make sure I've got really good sun cream on, but I do that all the time as a matter of course. It doesn't matter what time of the year it is, there's pretty much the same amount of UVA around, whether it's cloudy or whether it's sunny, and really good sunscreen all day, all year round, even if you're inside, is really an essential part of this at-home treatment. So I hope that's helpful. I hope it's interested you in the idea of microneedling. And I will be back next week talking about something. It'll be a surprise. I haven't quite decided what it's going to be yet. And yeah, have a great day. Look forward to seeing you next week. Bye.